Hello, good day to you. Are you a student nurse? If you're a student nurse, this video is for you. So, most times prior to your practical exam, the reason why you are being posted to the ward is to get familiarized with the cases in the ward that you are going to be carrying out your practical in. Okay, so it shouldn't be a period of tension. So once you resume your shift, you go through the patient case note, you get information about the patient you're caring for. Then for newly admitted patient, get to know their diagnosis, read more about that diagnosis, signs and symptoms expected for that diagnosis, who it is PUD, what are the symptoms you see in the PUD patient. That will help you to be able to know the nursing care needs of that particular patient. Okay. For a patient with perforated PUD, that is perforated peptic ulcer disease, you actually expect a drop in PCV of the patient, then hemodynamics instability, then you expect pain, you also expect black tarry stool. So these are things you look out for. So you watch for um, vital signs of the patient. If the blood pressure is stable, you need to monitor the patient closely. Some do have vomiting and stooling of blood. So most times, each episode of stool they pass, they lose their PCV drops. So you'll be able to know all this, and then you know that you need to monitor patients to take stool sample for culture and sensitivity and analysis or stool analysis. Then you chase the lab works. If you want to be a good nurse, always chase the lab works of your patient. So follow up and be proactive for when there's a derangement in the PCV or any kind of test that was done. Then you draw the doctor's attention to it. Okay, so as a student nurse, eve of your practical is when you're going to know the real patients you'll be using for practical. That is a night to your practical day. Is the period that you know the real patient that will be around that for you to use for your practical. Okay, we're doing a hospital-based practical evaluation for student nurses. So what you need to do is establish rapport with your patient, know their names, their diagnosis, their bed number, their wards. Okay, then signs and symptoms, the treatment the patient is on, all the drugs. You can still go ahead to read about the drugs patient is being on. Then you know the investigation results of the patient, then expected outcome of each treatment plan the patient is on. So if patient is on 6-hourly fluids administration, you're going to do input and output monitoring. So if you're having an unconscious patient, you should expect much more nursing procedure in that kind of patient because a conscious patient needs a holistic nursing care. Holistic at the point that head to toe care. Everything about the patient is you that's going to do it. Okay, it's you that will do 2-hourly turning, it's you that will do input and output, it's you that will empty it's you that will empty the urinals for the patient, is you that will monitor urine output and then intravenous feed again patient, is you that will feed the patient, you do NGT feeding, so you do pressure area care, you do drug administration via the NG tube. So there's a lot of nursing procedures you can get from a patient, an unconscious patient. You see, you should be proactive to know which procedure your supervisor will likely to assign you to do for that patient. So that's why they send you beforehand to go and familiarize yourself in the ward and then the kind of patient and the kind of cases you're having. So it's left for you if you want to come out well in that your practical exam. It's left for you to actually go through all this. Then you can also proactively prepare nursing care plan for this patient you have. Draw out a nursing care plan. Have at least 2 nursing diagnosis each for this patient you're having in the ward. Okay. Then use your procedure manual. Procedure manual is your weapon. Okay. Because it stated all the step-by-step nursing care you can do for each particular nursing procedure. If you say NG2 feeding, right from equipment, gathering of equipment, if it's a trolley procedure, tray procedure, it's stated in your procedure manual. Then if it is a 2-man procedure, it's also there, stated there. Okay, so then you now approach it so that if you can get every necessary equipment that you need for that procedure, it will give you a score. You meet up to a score. Then when you are assigned to do a pressure area care for a patient, first of all, you get to introduce yourself to the patient. You say, "Good day, Mrs. Jones. I'm Susan Nurse Stacy, and I'm allocated to you that I should take care of you. I should do your vital sign, or I should do this procedure for you. So can I go ahead? You give me your consent." So seeking of consent of patient will give you a score. Then introduce yourself will give you a score. Then telling the patient what procedure you are going to do for him or